Hey guys, Councillor Lisa Robinson here. Let's start with a fact Canadians deserve to know right out of the gate. Canada's health minister is not medically trained. She's not a physician, she's not an epidemiologist, she's not a public health scientist. Her academic background is in social and organizational psychology. That's the study of human behavior, group dynamics, compliance, authority, and institutional messaging. Now you're asking yourself, why does this matter? Well, because last week, the same health minister told Canadians we can no longer trust the United States as a reliable partner on health information, including vaccines. Not because of new medical evidence emerged, not because the science suddenly changed, but because the politics did. So ask yourself why. Why would a health minister trained not in medicine, but in behavioral influence move to shut down comparison, debate, and questioning between countries? Why is the response not, let's examine the evidence together, but instead, don't listen to them? That's not medicine. That's political messaging. Here's what people need to understand. When skepticism is framed as harmful, when questions are treated as threats, when debate is discouraged instead of welcomed, the goal is no longer health. The goal becomes compliance. And that's the end game. In that system, trust is not earned through transparency or outcomes. It is now demanded through authority. Disagreements become misinformation, questions become dangerous, and independent thought becomes a behavior to be managed. That is not how science functions. That is how behavioral policy functions. That is social influence in service of power. Exactly the field our Canadians' health minister is trained in. And notice how this pattern doesn't stop at health. Across all levels of government, questions are shut down, debate is restricted, and those who challenge decisions are routinely labeled, dismissed, or marginalized. And in some cases, people aren't just called names like me, they're financially punished, professionally isolated, or made examples of, incrementally, through process. Just enough to teach others not to follow. That doesn't strengthen democracy. That is how dissent is neutralized. Science doesn't not fear questions, truth does not fear scrutiny, and legitimate authority does not need silence to survive. A critical system welcomes debate. Only fragile authority demands obedience. So Canadians should ask themselves this: why does a health minister trained in behavioral psychology and compliance seek to limit debate, comparison, and questioning instead of encouraging it? Why is skepticism treated as a problem to solve instead of a safeguard? Because when questioning authority is framed as immoral, obedience becomes a measure of virtue. And at that point, this is no longer public health, it's behavioral control. Canadians deserve better than programmable messaging. They deserve evidence, they deserve debate, and they deserve a government that does not fear being questioned. I am Councillor Lisa Robinson, the People's Councillor, and I will never whisper the truth to protect a lie. If you believe that real power belongs to the people, follow me, subscribe, and please share this message. Until next time, stand strong, stay fierce, and God bless.